Good morning everyone. We are taking today the revision topic of certification and report writing of person who has consumed alcohol. Consume alcohol up to the level of drunkenness. The situation in which the person who has consumed alcohol in a such amount that he has lose control of all mental faculties has been brought to medical officer in various circumstances. The circumstances in which medical officer is required to examine and give opinion as regard to alcohol misuse, like in cases of homicide, sudden death, road traffic accident, and all sort of assault cases, where the medical officer is required to examine the said person who has been brought by the IO or investigating officer. The act is due to the deleterious effect of alcohol. That situation or that mental condition as a result of alcohol consumption, in which the person loses control of routine mental faculties, is called as a drunkenness. By bookish definition, it is a condition produced in a person who has taken alcohol in a quantity sufficient enough to cause him to lose control of his faculties to such an extent that he is unable to execute safely the occupation in which he was engaged at particular material time. Here is the quantity is not mentioned, means it could be any quantity at that material time which loses the control of all mental faculties of that particular person. So that condition is called as a drunkenness. Drunkenness is a condition. Sufficient quantity has to be taken. Means it is cannot be measured in terms of how much pack has been taken by that person, because alcohol is a substance which acts differently on different person on different occasion. So various factors which govern the absorption of alcohol one must know. The various factors means the type of liquor which has been taken, like rum, vodka, whiskey, wine, beers. It has the different type of concentrations, like in rum and vodka, the concentration of alcohol means ethyl alcohol. Whenever I use the term alcohol, it stick to the ethyl alcohol, which is a consumable substance. Various preparations are there, and the concentration is depend upon the type of alcohol. In a theory class, you have been told that there are various units, various beverages contain various amount of alcohol. So in rum and vodka, the ethyl alcohol in that particular beverage is around 50 to 60%. In whiskey, gin and brandy contain around 40 to 45%. In wine it is around 10 to 15%, and beers is around 4 to 8%. Different type of beers and all these things are there. The country liquor which is known as a arak. Arak is a Eastern name for any country liquor, especially that is distilled from the cocoa palm or from rice or sugar or from jaggery. That the strength of Indian liquor is about the same that is of whiskey, but as they never mature, therefore they contain a comparatively high percentage of higher alcohols, which are more intoxicating than the spirit or beverages of Indian or European distiller makes. So these are the arak, and various factors which interferes with the absorption of alcohol, the concentration of alcohol, presence or absence of food in the stomach, type of food which has been consumed, emptying rate of the stomach, or neat spirit, or whatever it may be, the type of food, type of diluting substance like carbonated substance has been used, or it is on the rocks or water, whatever it may be. These are the various factors. Certain natural diseases like diabetes, hypertension, kidney function, liver function, hepatitis, cirrhosis, these are the various things which govern or which interfere the alcohol concentration in blood. The alcohol concentration in blood, which is means the amount of alcohol which is acting over the brain, not only the alcohol substance in the stomach. It is the alcohol concentration of blood means that alcohol is acting over the brain. That's why the alcohol concentration of blood is very, very important. And different countries have the different statutory limit. Recently, Motor Vehicle Act in India has been amended. Previously, it is 0.3 gram percent of alcohol is punishable. More than 0.3 gram percent is punishable to drunk and drive. Now, recently it is amended, Motor Vehicle Act 117. Any amount of alcohol is punishable. The various concentration of alcohol has the various effect, clinical effect over that particular person. Just like if the blood alcohol level is between 0 to 50 milligram percent, person is dry and decent. 50 to 100 milligram, delighted and devilish. 100 to 200 milligram percent, it is delinquent and disgusting. 200 to 300 milligram, dizzy and delirious. And 300 to 400 milligram, dazed and dejected. 400 to 500 milligram, it is dead and drunk. These are the various usual concentrations. It is not applicable to particular case, but it is a usual concentration with a different clinical manifestation as described. Around 400 to 600 milligram percent of blood alcohol level is the fatal in usual circumstances. The death could be due to direct depressive effect upon the brainstem mediated by the respiratory center, or due to aspiration of vomiters. There are various kinds of causes of death. Sometimes it is direct, sometimes it is indirect, means causing accident or assault or drowning, anything can be happen. So in these circumstances one has to examine for that particular person. The clinical diagnosis, the drunken person has been brought to us, then we have to perform certain clinical test. The clinical diagnosis depend upon the combination of number of symptoms and signs, no single one of them being peculiar to this condition. Means there are differential diagnosis of that particular clinical manifestation, except the odor of alcohol from the breath. Odor of alcohol is the diagnostic one. An individual can react differently under different circumstances, and that this same amount of alcohol can produce different effects on different people under the same circumstances. Means it is not once he has taken one pack and he is drunken at this particular time, but some other time two pack of that alcohol is not producing that effect which is produced lastly by one pack. Again I am repeating, an individual can react differently under different circumstances, and that the same amount of alcohol can produce different effects on different people under the same circumstances. So this statement is very, very crucial one, and one always remember this statement whenever one is examining for the drunken person. So the order is the diagnostic one for the drunken person. The various conditions that simulate with acute alcohol intoxication, like who is this? मैम मैं अभी लेक्चर में हूँ, ठीक है. Various condition, the needs of certification. These are the cases in which one has to certify. There are various conditions which simulate with the acute alcohol intoxication, like head injury, hypoglycemia, diabetic pre-coma, uremia, hyperthyroidism, impending cardiovascular stroke, disseminated sclerosis, intracranial tumor, Parkinsonism, epilepsy due to overdosage of insulin, barbiturate, morphine. These conditions are simulate with the acute alcohol intoxication. Means this should be excluded when one is examining. These are the differential diagnoses. A medical officer is required to examine and certify a case of drunkenness in wherever a medical legal issue arises. The aim of examination and certification is to determine certain things. Number one, whether the subject is under the influence of alcohol, and if so, to what extent. Number two, whether his condition is due to illness or injury. Number three, whether it is safe for him to be detained in a police station or to decide whether he is to be admitted to a hospital. These are the aims and objectives of any examination of person who is consumed alcohol or in certification of drunkenness. So first one has to take in every examination the consent. Informed written consent should be obtained before proceeding with the examination. If the consent is denied, reasonable force can be applied on an arrested accused for physical examination. Under section 53 of CRPC, if the person is incapable of giving consent by reason of unconsciousness or gross intoxication, the doctor may make him examination, take samples and give treatment as is necessary to save the life. However, he may not divulge the result of his examination until he can obtain the consent of the patient or the patient dies, except when directed to do so by the court. Then one has to take certain precautions. Before that, the usual signs of drunkenness one must know. There will be strong odor of alcohol in breath, loss of self-control and clearness of intellect, unsteady gait, vacant look, congested eyes, sluggish and dilated pupils, increase in pulse, thick and slurred speech, random talk, lack of perception and muscular coordination. These are the general clinical behavior appearance of a person who is in a drunken state. This is the pro forma. This pro forma as per the Bombay Prohibition Act. Examination of alcohol, in which you have to write the general particulars, consent, thumb impression, 2 identification mark from visible point, visible body part, and these things to be noted down. There are form A and form B. This is given in your journal. Name of individual, patient or guardian's name, address, age. Then we have to go for the history. As I already told to you, there are various conditions which are simulated with the acute alcohol intoxication, like the head injury, metabolic disorders like hypoglycemia, diabetic coma, uremia or hyperthyroidism, certain neurological diseases like intracranial tumor, Parkinsonism, epilepsy, certain drugs, the overdosage of that drug like insulin, barbiturate, atropine, or certain pre-existing psychological disorder like hypomania, general paresis, etc. are in the differential diagnosis of acute alcohol consumption. So these things to be excluded. Then one has to note the general behavior. The general behavior of a person should be noted down. State of dress like presence of slobers on mouth or clothing, presence and character and color of vomiting, swelling of clothes by excretion or speech. Note the type, like is it thick or it is slurred or over precise. Slight blurring of certain consonants is one of the earliest sign of incoordination of the muscles of tongue and lips. Certain test phrases one can ask to bring out this difficulty in speech, like British Constitution, West Register State, truly rural. These are the phrases asked the person to tell when there is thickness or slurring while delivering these phrases. These are the things one has to note. A sober person will say this, that he is not good at such phrases. The semi-intoxicated person will often insist on getting them correctly, try to correct them, try to repeat these phrases frequently. Or one has to note down for the self-control, note whether he is able to control or not himself in response to demands made on him by the examiner. So whether the person is self-controlled or not, one has to make out. Then check for the memory and mental alertness. The memory of the person for recent events and his appreciation of the time can be judged by asking suitable question about his moments during the preceding few hours and the details of his accident, if any. A few very simple sums of additions or subtraction may be asked. Then check for the handwriting. the examinee should be asked to copy a few lines from a newspaper or book. A note should be made of the time taken, repetition or omission of word, ability to read his own writing. Both the original and the copy should be retained as an evidence, or that handwriting test should be performed on the clinical case paper only. Then check for the pulse. The resting pulse should be taken at the beginning and at the end of examination. The pulse is usually rapid and bounding. It is a non-specific sign. A slight increase in BP may occur, often in systolic level. Then look for the surface temperature, which is usually slightly increased. Note down the condition of the skin, whether skin is dry, moist, flushed or pale. In these terms one has to describe the finding. Then record the general state of mouth, teeth, tongue, noting whether the tongue is dry, furred or bitter. The smell of the breath should be recorded. Look out for the eyes, whether the general appearance, whether the lids are swollen or red, whether the conjunctiva are congested, the color of the eyes, any abnormality is seen or not. Like other condition, like in color of conjunctiva, whether it is congested or there is yellowness or there is other finding, one has to note down. Look for the visual acuity. Any gross defect should be noted. Intrinsic muscles. For that assessment of intrinsic muscle, look for the pupil, whether they are equal or unequal, dilated or contracted, whether they are reacting to light. Note whether the action is brisk, slow or absent. They may become unequal, equalizing again in response to light, and dilated again slowly, even if the light continues to be directed into the eyes. Then examine for the extrinsic muscle. For that, convergence test should be performed. For the convergence test, the degree of the ability to follow a finger in all normal direction, and the conversion the eyes normally on a near object. Strabism, note whether it is present or not. Nystagmus, the presence of lateral nystagmus indicate alcohol intoxication. Nystagmus may be produced by fatigue also, fatigue, emotions or postural hypotension, but it is a momentary. It is not constant one. Examine ear, examine for a gross impairment of hearing, abnormality of any drum. Look for gait. The integrity of nervous and muscular system is tested for the coordination of fine and gross movements like balance, gait and speech. The examinee should ask to walk across the room and note manner of walking, whether is it straight, irregular, over precise, unsteady, or the feet wide apart. The reaction time to turn also can be noted down. Does the examinee keep the balance, lurch forward or reel to the one side? Does he correct any mistake in a normal or exaggerated manner? That should be noted down. It is undesirable to ask the examiner to walk along the straight line on the floor. Next, stance. Note whether the examinee can stand with his eyes closed and heel together without swing. Then muscle coordination. Ask the examinee to perform the certain test like placing the finger nose test, placing finger to finger, picking up medium sized object from the floor like coins, etc., etc. Look for the small muscle activity or coordinated activity like unbuttoning and rebuttoning the coat or shirt, lighting a cigarette with a match. That is required to examine the coordinated movement of the small fingers. Then examiner should not ask the examinee to perform any act which he could not perform easily himself. He should also appreciate the difficulty involved for some people in apparently simple movements such as picking up small objects from the floor, or chronic alcohol when sober may not be able to perform the test for coordination as well as when they actually consume alcohol. So these things should be taken precaution. There is placing the finger to nose test, placing finger to finger, picking up a small size object from the floor, lighting a cigarette with a match, unbuttoning and rebuttoning the coat. This test to be performed. Then certain reflexes to be examined, that is knee and ankle reflexes should be tested which are delayed or sluggish. Look for plantar reflex which may be extensor or flexor. Pulmonary, cardiovascular and alimentary system should be examined as usual. The heart, lung and abdomen should be examined and the blood pressure taken to establish the presence or absence of certain diseases. Certain tests, some of the following tests, these display tests are useful. The flicker flush fusion test, measurement of tremors during the standing, oscillations during force imbalance, pupillary reflex time, speed of spinal reflexes, presence of random ocular movement with closed eyes, nerve conduction speed, complex reaction time, delayed auditory feedback, positional nystagmus, glare recovery test, color different threshold. These are the tests can be performed to assess. The important thing is the laboratory investigation. Blood is the most suitable and direct evidence of the alcohol in the brain. The degree of intoxication can be estimated by the concentration of alcohol in the blood, urine, breath or saliva. In the fatal accidents with a partial body destruction, muscles or the fluid in the eye can be also analyzed. Vitreous humor and urine are protected from putrefaction process for a longer period of time and don't contain much glucose. Because of that, they are the ideal samples in case of death. But in case of drunkenness, means the person is alive, in that circumstances, blood and urine one has to take. Blood is the most suitable and direct evidence of alcohol in the brain. But it has certain disadvantages. What are those disadvantages? It may be difficult to collect from uncooperative person. Consent of persons is necessary, and substance such as acetone, ether, when present in the blood are estimated as alcohol. So while we are drawing the blood, collecting the sample, certain precaution one must take. Use clean container with adequate preservative. The preservative is 10 mg of sodium fluoride and 30 mg of potassium oxalate for 10 cc of blood, followed by thorough shaking is best preservative for blood sample. And avoid using spirit. Don't use spirit for cleaning the skin before obtaining the blood samples. Instead of that, one can use 2.5% of mercurochrome or gentian violet solution for cleaning the skin. Use of swab containing isopropyl alcohol or dry swabbing is also advocated, but it is better not to use these things. Other alternative other than alcohol should be used for the cleaning the skin. And obtain sample with clean needle and syringe, which should be free of any traces of alcohol, from peripheral vein, either femoral or subclavian or subcutaneous cubital vessels. These are the precautions to be taken. Spirit must not be used for cleaning this surface, and the syringe must be free from trace of alcohol. The skin is cleaned with the solution of 1:1000 mercury chloride or washed with the soap or water. Blood should be preserved with addition of 100 mg of sodium fluoride or 30 mg of potassium oxalate for 10 ml, followed by thorough shaking. This prevents loss of alcohol by glycolysis and bacterial reaction. Such samples will maintain their alcohol concentration for several weeks, even at room temperature. A screw capped glass bottles of universal size is suitable. The container should be tightly clamped and sealed to prevent loss of alcohol by evaporation. Label by name, date and time of taking sample. The precaution is to be taken. Rubber stoppers should be avoided because they may contaminate the sample with oxidizable substances. If they are not transmitted at once to the laboratory, they should be refrigerated but must not be frozen. Freezing will cause the cell to lyse. The precaution to be taken. Another sample to be taken is urine. Urine should be preserved in 30 mg of phenyl mercuric nitrate or sodium azide to every 10 ml. Urine has about 25% more water than equal volume of blood, so its concentration of alcohol would be about 25% higher in the blood collected at the same time. As the urine is secreted, its water will be essentially the same alcohol concentration as the water of the blood passing through the kidney. If the bladder contained urine before drinking began, urine secreted during and after the period will be diluted with the alcohol-free urine. So, amount of urine, if the bladder was empty when the drinking begins, the urine secreted after some time will reflect the blood concentration of alcohol at that time. In order to compare the urine and blood, a ratio of 1.3:1 is usually accepted when the urine and blood are in equilibrium. Analysis of two urine samples are required. First sample has to be taken at the beginning of the examination, and second sample is after concluding the examination, by which one is able to know the ratio of the urine concentration, whether it is in a decreasing trend or increasing trend. So two samples of both is required while concluding anything, whether the urine or blood in increasing amount or decreasing. The trend should be only possible when two reports are there. So analysis of two urine samples are required. The first sample should be taken as soon as possible following the incident, the bladder being empty. The second sample should be taken 25 to 30 minutes later. The concentration of the second sample reflects the blood alcohol level during the inter-specimen interval. The difference in the alcohol concentration in two samples indicate whether the subject was absorptive phase or in secretory phase. There are certain disadvantages. A time lag before the equilibrium between the blood and urine is reached. The maximum concentration is reached about 20 to 25 minutes later than in blood. The urine alcohol concentration at any given time after the maximum concentration in blood has been reached will be higher by 20 to 30% than in blood. Alcohol may pass through the lining of the bladder in either direction, both in life and after death, depending on the relative concentration of alcohol in blood and urine. So these are the certain precautions and samples to be taken. All the parameters is as per the Bombay Prohibition Act. So in that circumstances, the diagnosis to be made. The usual signs of drunkenness are strong odor of alcohol in breath, loss of self-control, clearness of intellect, unsteady gait, vacant look, congested eyes, sluggish or dilated pupil, dry lips, increased pulse rate, unsteady and thick voice, talks at random and lack of perception of passage of time. There are usually no difficulties while diagnosing these cases. In extreme cases, like that is whether the person is clearly drunk or clearly sober. The problem arises in marginal cases or those with intermediate degree in the disturbances of behavior. The usual signs of drunkenness I already mentioned to you that should be taken account for diagnosis. The determination of alcohol helps to know the concentration of alcohol circulating in the blood, to determine within the fairly wide limit how much alcohol must have been imbibed within a certain period of time, to assist the doctor in confirming his suspicion, enable the court to accept the clinical diagnosis, serve to resolve conflict reports given by the non-medical witnesses. These are the importances of estimating sending the sample of alcohol for analysis. And the diagnosis to be made as per Bombay Prohibition Act, whether the person is consume alcohol or not. If person is consume alcohol, whether he is under the influence of not, that is to be made as per Bombay Prohibition Act. Then certification should be made as a form and B form. In A form, one has to certify the clinical diagnosis, and in B form it is made to send the sample for the chemical analysis. This is a statutory requirement and one has to be stick with that pro forma. Thank you.